why don't we kick off with our first presenter? And it's a real pleasure to invite Dr. Ferew Lemma to come and speak to us. Dr. Lemma is a public health physician with a PhD from the London School of Hygiene and Tropical Medicine. He trained at Jimma University in Ethiopia, which I've had the privilege and pleasure of visiting some years ago. And he has a strong research interest in nutrition and health systems research. He's currently working as a senior advisor at the Office of the Ministry of Health in Ethiopia. So please give Dr. Lemma your very warm welcome.
Thank you for the introduction, and thank you for the Lancet for giving us this opportunity to contribute as well as be here today. I'll be presenting the country experience in terms of scaling up nutrition as well as these four areas. So I'll try to cover briefly these four areas, what progress has been made since the last Lancet or our own national nutrition program, what evidences led to develop policies and programs and action, how do we actually see, monitor, and assess our progress, and what SUN looks like at country level. In terms of progress, we see from our recent demographic and health survey that the rates of stunting has quite reduced by over 20%, as well as underweight at the same rate, and in the last 10 years. And one thing we have to understand here is Ethiopia started at a very high rate when the MDGs started. We have around stunting of about 70%, and the same as underweight. But now we are on the right direction. We still have 5.5 million under 5 children which are stunted, and around 3.5 million children underweight. So that is quite high. And our wasting, unlike other African countries or in the region, it is quite high. Most of the countries around 5%. But we'll see why that is. So, and this tells us not only that these children are already having a bad start, but the children from those stunted, there are about 40 to 50% dying every year. And if we don't do anything now, they will continue to do so in the next 5-10 years. In terms of macronutrients and in adults, yes, the rates have reduced quite by around 19-20% in terms of children and women as well. But if you see the level of chronic energy deficiency or low BMI in adults, it's quite high, and it didn't change. And that is the current workforce we are using. About 68% of our workforce is already compromised because they were stunted as children. But this hasn't reduced, and that is why this new Lancet is telling us we need to work on adolescents besides what we are doing in children, and we think we have new bullets to work with. On the contrary, in big cities like Addis Ababa, we have 1 in 10 women who are overweight or obese. So the problem of the double burden is starting in Ethiopia. The men, 1 in 20 men are also overweight or obese, so in the major cities. So we are handling with one problem when another one is rising. And I think because of the double-digit economic growth that has been happening, but the rate of the reduction is not equivalent to that. So yes, there has been progress. We started at a very high rate, but we are going in the right direction, and this is progress, but we are not complacent, and we hope we'll continue from this. And what triggered action in Ethiopia in terms of the policy makers or the decision makers? I'll show you one graph. This is in both 2005 and 10-11. The demographic survey showed us the regional variations in stunting. And these red bar graphs are the highest producing areas, the surplus producing regions, except Afar. And they have the higher rates than the national average. So it doesn't mean that having a high income or producing a lot high doesn't mean you'll have low number of stunting. In fact, it is the contrary. So it seems that income doesn't only affect that. But when the ministers and the Ministry of Agriculture saw this, they said, yeah, but you also assess the poor people in the surplus producing areas. We said, okay, this is how it distributes among the wealth quintiles. So at least all of the 1 to 4, the wealth quintiles from the poorest to the highest have equal chance of being stunted or are equally stunted. So it's not only those who are poor, but it's everybody that has a chance of being stunted. So only economic growth or having high income doesn't mean you'll have low stunting. And this, in 2008, in 2005, and after 2008, it created a momentum, and the first national nutrition strategy was developed in Ethiopia. And after that, it has continued with the same momentum. And now we have the National Socio-Economic Development Plan of Ethiopia, which is also known as the Growth and Transformation Plan. And it has put as the face of poverty, stunting reduction rates indicators, as well as anemia and breastfeeding and low birth weight as part of a national development plan. And also all these, the other ones, feed into this growth and national. So we have plans in agriculture, education, as well as social protection policy, which just came out recently. So the momentum has continued since 2008, and we have programs and policies which are in place. And I think the nutrition agenda has become the second top priority of the Ministry of Health, and as well as other sectors now, particularly agriculture and education most recently. How do we actually assess our progress? We have multiple ways of assessing it. We have the health management information system, which is the routine system we have, which comes every quarter and compiled annually and reported, which comes through the existing health system. We also have the emergency nutrition reported through the public health emergency, as well as the emergency in agriculture, the emergency unit in agriculture. And these two come together under the health management information system as well and reported annually. We also have pre and post national nutrition program surveys, evaluations, which is done by the Government Research Institute. And we usually have biannual or periodic surveys because of the seasonality changes in Ethiopia. And this can be seen here. We started, this is a figure showing you when we started our community management of acute malnutrition and what we have achieved up to now. When we started in 2004 and 3, we had about 44 sites which are doing CMAM, or community management of acute malnutrition. Currently, the number has grown to over 10,000 sites. Why? Because of the health extension program. Because the health extension program was there since 2004. And the number of the fluctuations you see in these graphs are showing you seasonalities. And when the number of cases seem increased, but it's actually the number of reports coming through the 10,000 sites is increasing, so the figures look as if the number of cases which are admitted is increasing, but the number of sites which are reporting is increasing. So we have 0.4 or 1% of deaths, and the quality, we have worked quite a lot on the quality. So this is how a routine system data comes in every month, every quarter, and that's what it looks like. And this is the map of the country, which it shows you all nutrition interventions in Ethiopia. We are trying to reach everywhere, so the yellow triangles are sites which we do community management or OTP sites, or sites which we do CMAM, and the red dots are our sentinel sites, biannual surveys are done there. The small figure of a human being or are mobile health and nutrition teams, which are mostly found in pastoralist areas. All these report through at community level and to the district and regional level and come to the Ministry of Health every quarter. And our programs are also distributed. The dark blue shows you, we do assessments, nutritional assessment to under 5s and pregnant and lactating women. The dark ones show you what we do every 6 months, and the light blue one is what we do or the child health days we do every 3 months. We also use the opportunity in the whole country to distribute vitamin A and supplementation as well as do deworming. So these are some of the information you get through the routine and as well as the periodic service. In terms of sun in Ethiopia, the sun is positioned in 2 areas. One is the sun is, we have a coordination system which I try to summarize here. We have a National Nutrition Coordination Body which constitutes of 8 sector ministries or state ministers or deputy ministers of each 8 sectors sit in that committee. And we have technical people of these 8 sectors constitute the National Nutrition Technical Committee. And in these 2 sections, the sun is a secretariat, for example, for the National Nutrition Coordination Body for the state ministers, and it plays a catalytic role or facilitation role, and that's what it does out there. And in actually the National Nutrition Technical Committee, what sun is doing is, it usually is a secretary or usually chairs the meetings of these, building the capacity of the different sectors in terms of what is nutrition and what nutrition sensitive means and how things are done globally and what could be taken for the national level discussions. And after SAN, I think we have the government, as you all know, has endorsed SAN in Ethiopia, and we are one of the early risers. And it has galvanized most partners. Partners which were not investing in nutrition before are now working with us. And since the SAN in 2010, after 2010, I think around 200 million US dollars have been raised in Ethiopia for nutrition, specifically for nutrition-specific interventions. And we have planned and refocused our programs based on the first series as well as some of the lessons which are appearing globally. And there are sectors from the private sector as shown to enter into public-private partnership, which we are working on. And these have enabled us to develop our own new national nutrition program, which we hope we will be launching with the Lancet in June 24 in Ethiopia, Addis Ababa. If anybody is passing through, they are welcome. And we also have a new cost done, which is the cost of hunger in Ethiopia, which tells us about the social and economic cost of hunger in Ethiopia. So if anybody comes in, they will see on June 24. And moving forward, I think in this cost, we have seen that if we continue as we are, the rate of stunting will not reduce in Ethiopia with, as we used to see it, 1.7, 1.5% per annum. But actually, the cost of hunger or the cost of stunting in Ethiopia will increase. But if we reduce stunting by half, if we follow this dotted line, the difference between these 2 lines is 387 million US dollars per year. That is what would mean in saving. And this is only going to, I think, almost 2% per year reduction. If you want to go to 10, the difference between this green line and the purple line is 784 million US dollars per year saving. And that's only due to stunting. Thank you.
Thank you very much. We'll come to questions when we have all the panel up. Now, who's going to have the next slide presentation? Next is Andrew. Fantastic. So Professor Andrew Dorward, who's Professor of Development Economics at SOAS here in London. Andrew, it's all yours. I think you have to use this, otherwise.
Right, not too much. Thank you very much indeed to the Lancet for the invitation, to Bob for your invitation. And I should just say I'm also a member of the Leverhulme Centre for Integrating Research in Agriculture and Health, LCERA, which some of you are familiar with. I'm an agricultural development economist, so I've been a fly on the wall here, learning a lot today and looking at things from a different perspective from most of the other people in the room, I guess. And my role, I think, is really to comment on, particularly on Marie's paper, the nutrition-sensitive paper, and particularly on nutrition-sensitive agriculture. And as the days gone on, I've become aware that there are framing issues here. It was sort of stimulated by Lawrence's presentation to think that actually I frame things differently, I think, from the sort of community, if you like, framing that I'm picking up. So my comments, I think, have to be interpreted in that light. So I'd like to welcome Marie's paper. I think it makes an important contribution to a field in which there's growing interest and a growing but still limited literature. The key messages, she's summarized in the paper and she summarized them in the presentation this morning. Enormous potential for integrating agriculture and nutrition interventions. There's complementation there. There's also the importance of protection and mitigation of the threats we face from climate change, from high food prices, from volatile food prices, but limited good quality evidence on that. A lot of theory, but on the particular nutrition agriculture interactions, apart from really for the biofortification story, limited evidence. And that means we need to improve that evidence. And the other main thing I think that Marie highlighted is the need for targeting and running right through it the importance of women in every sphere. And women are critically important in agriculture in terms of their contribution, in terms of their usage of food, in terms of their roles in childcare. So hugely important, but also affected by imbalances in control over resources and demands on their time. Inside the paper, there's more than those key messages, obviously, and I welcome the emphasis on synergies, on the critical constraints, the need. There are so many necessary but insufficient constraints, and bringing those together is a critical issue. And then the coordination challenges that very much came up in Marie's paper, but also were highlighted in Lawrence's presentation. Now, I want then to just go on to say where I would perhaps have a slightly different emphasis, things I would stress more, but I'm also aware of the Lancet page limits. So just to add fuel to the fire, Richard. And here, some of this, I think, comes from the framing question. Now, I really appreciate the framework for the series. I think that's really helpful. But I also realized that actually that's also an area where I have a different framing, because I look at it from the agricultural side, and so I think of the different contributions that agriculture can make to nutrition, which is a bit different from asking what are the agricultural programs that can be nutrition sensitive. Now that's a slightly nuanced distinction, but maybe it'll become a bit clearer, and if it doesn't, then we can always try, and I can try and clarify it in questions. Now I want to illustrate that by, I only got one slide, but there's lots of things coming into it. So 3 different pathways of contribution of agriculture to nutrition. And the first one is the development pathway. And that's not just an agricultural pathway. Agriculture has critical contributions to make to development. And by development, I'm thinking in terms of growing incomes. I'm also thinking in terms of structural change. Structural change may be in terms of the structure of economies, the importance of agriculture declining, non-agricultural activities becoming more important. The same food, the importance of food in people's expenditures declining and increasing urbanization. So those sorts of things are going on, and agriculture can make an important contribution to those, but the importance of that contribution varies between countries and it changes over time. As countries develop, the role of agriculture declines. It's a slight paradox. The second pathway is on the right-hand side, the producer pathway. And these are closely related. It's difficult to separate them out. But here we're thinking of producers producing things for themselves, for their own consumption, also for sale and for income. Clearly that's related to the development pathway, but the development pathway is also concerned with these structural changes, which may not happen just with the producer pathway. And the third pathway is the market pathway, in terms of what is being produced and coming through to consumers and what are they demanding. Clearly that's again closely related to the development pathway. Part of the structural change is the movement of people from rural areas to cities, from being agricultural producers to being employed in non-agricultural employment and purely buying their food. And so those market changes become critical there. And we can sort of look at this in terms of interactions between them, overlaps between them, and there will be overlaps. And we look at it too in terms of ways that particular countries or particular groups within countries move. We have a dynamic system. And therefore we have to think about the context specificity of these interactions, of these pathways. They change. What's important in them is going to change over time, and you get groups moving around, if you like. So you might have an urban group which isn't there at the beginning but is there later on and becomes very important. So just to complete this, we need to think about this in the context of lots of other things. Some of these are nutrition-specific interventions. Others are other things that have been looked at, and I focused as women's education and status critical up there. Agri-food regulation is a more agricultural thing. The others are mainly nutrition-specific, although we have education and sanitation. We could add to more things around there, and then around the outside we have the wider things and policy and governance. That was at the top before I read Lawrence's and Stewart's paper, but it's obviously absolutely critical. Okay, so that's the way I think about things, and yet these three pathways are there in the paper. So there's discussion of the impact of incomes on stunting. There's discussion of the value chain, nutritional or nutrient value chains, which I think is another way of looking at the market pathway. And the major emphasis on the paper is on the producer pathway, and the paper is about targeted agricultural programs. And if you like, that is defining the paper as being in this corner, which for me is a slight bit of a problem, because often I think people interpret this as being the impact of agriculture on nutrition. But we've got to think about all three pathways together, and then think about the dynamics and the context specificity of those, and what are the priorities, to come back to Lawrence's paper presentation, in the different contexts. So I think that's the first general point I want to make. The second general point I want to make is that, and Marie made this, and I just want to stress it, lack of evidence of impact is not the same as evidence of lack of impact. And yet, to some extent, our whole method of testing of significance is going against that, because it says if you cannot disprove the null hypothesis, if you don't have evidence to disprove the null hypothesis no impact, for example, stands. And that is a problem, because we can often automatically just slip into that mode of presentation, and it's very misleading. And, okay, I've got to be controversial. Perhaps we should have null hypotheses that sometimes are the other way around. And I've thought this particularly with regard to climate change. The consequences of climate change are so severe that maybe you should have to prove that it's not happening rather than it is happening. Maybe the moral question you were raising means that we should have similar questions about nutrition. Okay, I've thrown a stone into the pond there. I'm going to step back. The third point I want to make, I think I've already made, which is the importance of context-specific interventions or combinations of interventions, and therefore also of evaluations of impact. We have to bring that context specificity into our program evaluation methods, because the contexts are going to vary, and what programs try to do and whether they're successful or not will depend upon their recognition of that context and their ability to deal with it. Finally, what next? Action, I think, is needed in all three pathways, and that there is a lot of interest in that. And here we come back to some of the themes we've had already today. Action needs evidence, otherwise it runs into the sand. The agriculture community is not as united as the nutrition community. There are disagreements about the role of agriculture. There are disagreements about the type of agriculture and the importance of small-scale agriculture. So we're not singing from the same hymn sheet as I think I get the impression that you are today. We also need indicators. And I think this is quite a big issue. We need indicators that sit between nutrition and agriculture, or let's say they are nutrition-sensitive indicators for agriculture. So we need to somehow demonstrate the relationship between them as primarily agricultural indicators and nutrition. And ideally, they would also be relevant to the other benefits of agriculture. And this comes back to your point that we need to try and look at these things together. And from my perspective, I'm interested in all of the different benefits that come from agriculture or specific types of agriculture in different contexts. And there is work on this. I've proposed something called a food expenditure ratio, and you need to test that, which primarily looks at indicators for the development pathway. I think Derek Heddy has done some work recently looking at different indicators and suggesting that food diversity indices may be the best, and maybe that's sort of operating here. Here, where we have an issue of both the overweight and the underweight coming at the same time, I don't know what the indicators might be there, and this is not an area in which I personally work, but I think it's an important set of questions. Okay, I think I should stop there. My time is up. Thank you.